65-year-old female here for about 3 months of pain in the right shoulder. There's an x-ray which may show a blush of calcification, I think in the distal supraspinatus tendon. May have a loose body within the bicipital sheath, kind of distally towards the pec major tendon. We're going to go ahead and do an ultrasound.
Here we're going to go over this patient that has a torn biceps tendon with calcification near its stump, as well as tendinosis of the subscap tendon, as well as a partial articular sided tear of the supraspinatus tendon. Here you can see that tear of the supraspinatus tendon on its distal articular aspect, as well as thickening of the subscapularis tendon. Also, you can note irregularity of the superior facet of the greater tuberosity. And you can appreciate a stump on the long head of the biceps tendon with calcification right near that stump. Here we just remove that calcification and we're basically returning a normal biceps tendon and a normal supraspinatus tendon, as well as a normal superior facet of the greater tuberosity and a normal subscapularis tendon. Back to the picture, and here we are bringing back pec major muscle.
Here we are, we're kind of down towards pec major.
And here you can see the biceps tendon with a moderate effusion around it. Also appreciate the pectoralis major tendon and overlying muscle above that. And here again you can see the biceps tendon with an effusion. You can see the pec major muscle and tendon which is underneath the deltoid muscle. And again, here's a loose body with shadowing underneath it, and we can see that pec major tendon which is just very thin at this point.
I'm going to turn on this now. We're going to look at it in a long axis. Right side of the screen is distal. So here is that loose body within the bicipital sheath.
And here you can see this bright hyperechoic line, which is essentially the loose body, or it could be calcification of a distal stump of the biceps tendon, because you really don't appreciate a biceps tendon proximal to that. And also I asked the patient if she feels like there's something loose floating within the bicipital groove, and she said no.
I really don't see a whole lot afterwards. So she may just have like a torn biceps tendon, and there's some calcium kind of maybe at the stump. So now we're looking at a subscap tendon. Right side of the screen is lateral. Maybe a little thickened subscap tendon, somewhat tendinous.
Here you can see a thickened subscapularis tendon attaching onto the lesser tuberosity. And as per the Journal of Korean Medical Science, they did a study in Korean males, and their normal thickness was about 4.5 millimeters for the subscapularis tendon. And this was published online in June of 2016. Here also you can appreciate a thickened subdeltoid bursa, and you can see the normal interdigitation of the muscle in the tendon.
We're at that superior facet of the greater tuberosity, very irregular.
And here you can appreciate a distal articular sided tear of the distal anterior supraspinatus tendon abutting the superior facet of the greater tuberosity. Also, you can appreciate a moderate subdeltoid bursitis here as well.
Posteriorly.
And posterior, you can appreciate a fairly intact supraspinatus tendon. There's a little anisotropy, which is not a tendon tear. You can see it inserting on the flattened middle facet of the greater tuberosity.
Getting some more of that supraspinatus tendon, somewhat thin-looking tendon. You can see she's in a large subdeltoid bursitis.
And here again, you can appreciate that moderate subdeltoid bursitis shadowing underneath the acromion.
Alright, I'm going to look at it now in short axis. Kind of right side of the screen is anterior. We're expecting our biceps tendon in this groove anteriorly.
And now looking at the supraspinatus tendon in short axis, we can appreciate again that enlarged subdeltoid bursa. And I believe we got that tear here just right next to the superior facet of the greater tuberosity. We're not seeing much of a supraspinatus tendon in this view. Again, just a lot of irregularity of that greater tuberosity. And irregularity of the greater tuberosity is also a sign of a rotator cuff tear. And as you go posteriorly towards the middle facet, you can see a fairly well-preserved supraspinatus tendon, maybe a little bit on the thin side, but overall intact.
So here's our infraspinatus tendon. We're just following that distally. I think it's okay. Teres minor on the right,
Here we are looking at the teres minor and infraspinatus tendons in short axis, and they look fairly well preserved.
Spinatus on the left.
Also, you can appreciate a little divot between those two muscles, and here we're going laterally, and again you can appreciate infraspinatus tendon becoming more tendon and less muscle, as well as teres minor. Here's this patient's MRI. We can see the lack of a biceps tendon here in the sulcus, and here there may be some remnant of the biceps tendon in the sulcus. Here's another axial view where you can see some calcification or that loose body within the bicipital groove. Here's the biceps tendon distal to where the calcification is. And here's the actual calcification itself, or a loose body. Here's just proximal to it where you can see some fluid signal. Here is the biceps tendon, I believe, proximal to the calcification, and it's quite torn and diminished. Here's the irregular superior facet of the greater tuberosity. Here you can see some signal within the distal supraspinatus tendon. Here again is that torn, diminished biceps tendon, and here's that irregular superior facet of the greater tuberosity. Here's a sagittal view. It appears that she has a full thickness tear of that distal anterior supraspinatus tendon, but on ultrasound it appeared she had a high-grade partial tear of the distal anterior supraspinatus tendon. And here's that loose body again in the bicipital groove. You can get a nice view of it here.